welcome to Health Live at Seniors Today. We are here on a lovely Saturday evening, and we have here with us Dr. Amit Kohli, who's going to be speaking to us about physiotherapy for senior citizens and aquatic therapy, which he specializes in. With over 2 decades of experience in physiotherapy, Dr. Amit Kohli is Chief Physiotherapist and co-founder of Aquacentric. He holds a Master of Orthopedics and Manual Therapy degree from University of South Australia. He is internationally qualified in aquatic rehabilitation with degree from IATF Switzerland and advanced aquatic therapy from South Africa. Welcome to Health Live at Seniors Today, Dr. Kohli.
Thank you for the warm welcome, sir. Thank you so much.
So before we have a host of questions that have come in from our readers, from people who have registered. But before we do that, if you could, just give a few general observations on physiotherapy, on the need for physiotherapy, specifically for senior citizens, and then we'll get into the aquatic therapy thing later.
Sure. Physiotherapy is a branch of physical therapy medicine. It's a part of the mainstream medicine that we do. At Aquacentric Therapy, we have 4 verticals. That's orthopedics, neurology, pediatrics, and women's healthcare. We deal with different issues in each and every vertical. The common reasons why senior citizens usually they come to us are issues related to balance, their coordination. They sometimes, because of the balance, they'll end up having falls. They have pain, they have stiffness, they have a lot of tightness in the body. There is a generalized weakness, the bone density is kind of gone low. They have tingling numbness, they have edema. So there are various conditions for which the senior citizens basically come over to us. And we kind of go about treating them in different sections. So we do have land-based rehab, we have aquatic-based rehab, and we have an outdoor-based rehabilitation place as well. So that's how we basically look at treating various, the reasons why people come to us in terms of rehab for physiotherapy.
All right, and how has it been in the COVID period? Because obviously people are not able to step out to specialists like yourself and take physiotherapy sessions. What's it been like these last 6 months?
So in the past 6 months, we've had people basically restricted to homes and senior citizens restricted in their home environment. Previously, they used to go into the garden area, into their building. They used to go out to doing various activities outdoor, and suddenly the age bracket that they are in has made them quite restricted being at home. So including my parents. We've told them to kind of walk at home, do different things, but the common conditions, the common reasons that what they are kind of getting affected are basically they land up having a lot of weakness because activities what they were able to do previously able to go outside, they are not able to go outside. So there is a generalized weakness in the muscles. They've landed up having pain. They've landed up having balance issues now, coordination issues. There is edema, there's swelling in the legs which have started happening. So and obviously with all these things, their cardiorespiratory condition also gets affected. So if previously they were able to do a lot of activities there, suddenly if they do go out, the activity has kind of reduced. If they were able to walk, say, for 45 minutes, 6 months ago, they're finding it difficult to kind of complete half an hour. So their cardiorespiratory status has got kind of affected at the present moment.
Let me start with a question that I have received from Diana Karanjia, who says, I'm 65 years old and I would like to know, is frozen shoulder reversible? what causes it, and how can one prevent it?
So usually frozen shoulder around about post 60 can be the common condition for having a frozen shoulder is diabetes mellitus. So they land up having a lot of shoulder stiffness. The initial phase one, there is a lot of pain which is there. They'll end up having shoulders not able to go above the level of the hand not able to go above the level of your shoulder. Simple activities, wearing the bra strap, combing hair, having the toothbrush being done, they'll end up having a lot of pain. Diabetes, frozen shoulder also is associated with night pain. Typically, if a diabetic person lands up having a frozen shoulder on one side, within a year's time, there are chances to have it on the other side as well. Typically, for a frozen shoulder, it takes around about 3 to 6 months for it to kind of get better at. With exercises and with us, with doing a good amount of aquatic therapy, we can reduce that time period to around a couple of months. But you need to strengthen up the muscles for it to kind of get the pain completely out and the stiffness getting better as well.
Okay, thank you. You know, there's a question which has come in from an anonymous attendee who says that in this lockdown period, my sedentary job has become more sedentary. Is there something specific that I should be doing in the lockdown period to ensure that there is a great amount of mobility? I'm 61 years old.
At home, because of this COVID issue, they do land up having a lot of joint stiffness. They do land up having pain. They do land up having their cardiovascular capacity being affected. Simple activities like climbing up and down the staircase, just outside your house, or going, doing some household chores, doing some stretching exercises will help them out to kind of get their pain and things being reduced, sir.
We have a question from Harsha Sanghari. I'm sorry to get the pronunciation wrong. My husband has numbness in the feet. Can you advise what could possibly be the reason and what he should be doing?
So numbness in the feet can be because of multiple things. It can be your spine that can be giving you trouble, some nerve irritation in the back. It can be diabetic neuropathy. It can be swelling in the feet. There can be multiple reasons for having swelling, for having numbness in the legs. Usually it will come from the lower back. It can be varicose veins as well that can give you trouble. So I think we need a bit more information. If they are able to connect with us, we'll be able to help them out on it.
Okay, thank you. We have a question from Nair Ravindranath. I'm 74 years old. Due to COVID-19 spreading in random, I don't go for a morning walk. Now, almost 6 months, I feel difficulty and get contented with exercise of legs and hands. Is this enough to get my mobility fit enough? How much time should I exercise?
So I would recommend to do around about 15-20 minutes in the morning, break it down to 15-20 minutes in the afternoon or half an hour, and then some activities in the evening time. Multiple times in a day, they look at doing activities. I usually recommend if they are able to just open the door, climb 2 stories up, do simple activities at home from like sit to stand position. You can get water bottles with around 1 liter or 2, use them as weight training. That will help to kind of have their bone strength being done, the muscle mass being maintained as well. So try using your own body weight. You can do some push-ups against the wall. You can do some push-ups against leaning against the chair or leaning against the table. And that should be able to help you out. Use your own body weight to kind of maintain the body mass, maintain your bone strength as well. a spot jog or spot running or walking at one place at spot, that also helps you out quite a bit. Again, I would say in terms of breathing techniques, I would strongly recommend spirometer to be done. A good amount of spirometer, which is having around about 1200 cc. Spirometer is basically a container with a pipe, and you have to have the air do a lot of inspiratory. So you have to try taking the air inside, and your lung kind of expands, and it helps the ball in the container will go up. And depending upon what cc you have, on the top of the container, there is 200, 400, 600, 800, 1200. Depending upon what cc you want to kind of strengthen your lungs, you would be able to do that. So I would strongly recommend a lot of people to have the spirometer being bought at home. That is really good.
Well, we've had some pulmonologists here, but would you recommend any specific type of a spirometer that they should buy?
Any spirometer which is more than 1200 to 2000. If you go to a COVID hospital, they are giving around about 2500 cc of the spirometer being given. So that it, and they have told recommend to around about do it every 3-4 hours for increasing the lung capacity. I would say anywhere between 1200 to 2500 cc for a normal person is pretty good enough.
We have a question from KD Dadanchi, who's very regular at the Health Life sessions. She says, Doctor, after a surgery on the navicular bone in my ankle 10 years back, I still feel a stiffness in my left leg when I stand for a long time. And that ankle swells with pain, whereas the other leg is okay. What should I do to reduce that swelling? I am 70 years old.
Yeah. I would also recommend, I would also want to go ahead and check her bone density actually, and see if that is a part of the reason for her discomfort. But the answer for ma'am would also be the same. What I said is to strengthen her other areas. You need to strengthen the ankle would be restricted in terms of mobility, in terms of her gait also will be affected. And a part of the reason will be higher chain. That is, you need to strengthen her glute muscles, core muscles, abdominal, pelvic floor. And then also make sure that when she's walking in the correct way. That means she needs to strike the heel first, then the foot goes down, then there is a weight bearing, then heel off and toe off. So a proper gait pattern is very important in order for her to ease the pain of the navicular. You can also look at mildly mobilizing the area where the discomfort is there. I would go ahead and check onto, as I said, her bone density as well. It is usually done in 3 places: the hips, the spine, and the wrist. We need to be in normal ranges and not into osteopenic or osteoporotic. If there is osteopenic or osteoporotic, then this area of the bone will keep hurting her quite a bit. So I would recommend her to kind of go ahead and check onto the bone density as well.
Okay, we have a question from Mr. Pardasani, who says, please suggest a solution. I'm an 80-year-old man suffering from stiffness in the little finger and the finger next to it in the right hand. What should I do?
Having stiffness in the little finger.
That's right. And the next one.
And the next one. This typically looks to be an issue with the ulnar nerve. So you would require a lot of stretching exercises. Something what I can recommend is keeping the hand like that and having these 2 fingers going behind. The moment you do that, this palm going behind the ears. The moment you do that, you will feel a lot of pull happening in the little finger and the ring finger. So it's a kind of a neural stretch that will be there. That will help to ease the discomfort out. But it is to do with, it can be coming from the neck as well in terms of the fingers. It can be as simple as when you sleep, you tend to keep your hand below the level of your head, and that can itself, the head can give you a pain up in the numbness in the little finger and this. But good stretching exercises will be able to help it out.
I'm 70 years old. I have pain in lower back on the left of where the backbone meets the legs bone. I do exercises, but I have pain in the pelvic muscle.
Correct. So this is a very common thing that happens if a person is having a low back pain. You can have a referred pain going into the legs. So it usually typically happens if there is a disc come out and irritating the nerve which is going out from there, and that radiates into the legs. What he would require is a good amount of stretching exercises, some mobilization technique into the spine, good core strengthening exercises, abdominal, and good pelvic floor strengthening exercises. After 50, there is a lot of pelvic floor muscles which tend to become very weak, and it requires a lot of strengthening, internal pelvic floor muscle strengthening, that is required to kind of ease the pain off.
Right. Yeah, thank you, doctor. We have a question from GN who says, Doctor, I have a pain in between the shoulder and the elbow. Shoulder and the elbow.
Okay.
And she or he is 65 years old.
Pain in the between the shoulder and the elbow can be coming from the issues pertaining to the shoulder, like rotator cuff, or can be coming from the neck. So a neck will give a radiating symptom into the hands, into up between the shoulder and the elbow. A shoulder joint can also give a pain into the in between going up here. So the movements will be restricted, the shoulder movements will be restricted, and any movement which is going out forward or behind can give you sharp pain going into the shoulder. So would require a bit more information on it, actually.
So Sandhya Makijani is 62 years old.
Yeah.
Went for a bilateral knee surgery in May 2019. She wants to know whether she can walk slowly on a treadmill or not.
If she's not having any pain, in my recommendation, I would want her to walk on normal at home on normal surfaces versus on treadmill, because when you're walking on a treadmill, you're depending upon the speed of the machine to walk, and that sometimes can end up having some injuries. My recommendation is to kind of go out in a normal outdoor environment, and like a terrace of a building or in your own garden, you can look at walking in that zone. But I'm not so sure I would kind of look at after bilateral knee replacement, making them walk on a treadmill. I would want to kind of use other surfaces, normal surfaces versus an artificial surface like a treadmill.
Right. I think we have a problem with your connection once again, but
can you hear me?
Yes, I can hear you.
Yeah.
So we have a question from Sameer Thakur, who asks, what is aquatic therapy or aquatic therapy? Will it help a person who has suffered with partial paralysis and is undergoing physiotherapy for the past 8-9 months? We are in Delhi and we would like to consult you. Is it possible? And there is another question from a viewer who also wants to know what aquatic therapy is. Is it safe in these COVID periods? Because it's, aqua means dealing with water.
Yeah. Thank you. Thank you for asking this question. The pools that we have are the most hygiene pools that we can ever think of, at least in the Indian environment. We've got various levels of sanitization, that is chlorine, we've got ozonators, we've got UV rays. It is an automated chemical dosing system. We have pools which are warm therapeutic indoor pools. Coming to the first question of the person having...
One second, you're talking about research, but there are so many research results that come out today. So can we really trust that research?
Yes, sir. So the Center for, so I would say during the pandemic, countries like Italy, US, and other places like Israel, they never stopped aquatic therapy, sir. In the in the hospitals, in the places, the aquatic therapy was continuously going on, sir.
And in your center, since when have you started the therapy in your pools after the pandemic struck us?
So we are in the process of having the necessary documents being we put up to the authorities, and we've asked waiting for it to start, and we are waiting basically for the authorities to give us a green signal to start, and we are at that place at the present moment, sir.
So we have a question which has come in from an anonymous attendee who says, can we do aquatic therapy at home?
If they do have pools, then certainly, why not?
But do you think you can have a jacuzzi and you know?
No, sir, that would not do. You need to be standing and in the water, and the water needs to be at the level of the shoulder before, to kind of do the therapy.
So there's a question from Ashwini Pillai who says, my mother has been experiencing sharp pain in her left arm. She lives an active life and is healthy. We are unable to find the cause of it, and due to the pandemic, her routine checkup is on hold. Is there any exercise that will help her?
So left shoulder pain can be as simple as a severe acidity issues to as complex as a cardiac issue. In terms of shoulder, in terms of exercises, um, I would say pendulum exercises. If she is able to have some TheraTube, TheraBand, she will be able to kind of do some strengthening exercises. If she is having some weight, like a bottle with 2-liter bottle, she can use it as weights and kind of do the exercises. So you can use your household equipment to itself, or you can do some push-ups as well to strengthen the muscle. If the pain is severe, then I would recommend, if the pain is more than say 6 or 7 out of 10, I would then recommend her to kind of take a teleconsultation, and we can dig a bit more into it.
Gurdeep Straw, who says, Dr. Kohli, your views on DSA, which is digital spine analysis.
Yes, sir. It is. It is a very nice tool to assess your mobility, your strength of the muscles, sir. It is a very good tool, and I usually a lot of good spine surgeons, they usually recommend as well, and we do regularly recommend for therapeutic analysis. We do for pre and post analysis. We do suggest for doing this testing, sir, DSA testing.
Thank you very much once again. And we'll be back with Health Live at Seniors Today again next Saturday. So, so please be there. Thank you very much.
Thank you. Thank you, sir.